There's a lot of misinformation out there. So the organization found that there was a need to provide better material for the patient. And so what we have on our website is what we call patient journeys. There's one for diabetes, one for thyroid, one for obesity, and a few others. And it provides them information, material on the journey of dealing with an endocrine disorder, what the symptoms are, what are the different therapies and things that can help you deal with that endocrine disorder.
This is Associations Thrive, the podcast celebrating successful associations and their leaders. I'm your host, Joanna Pineda, CEO and Chief Troublemaker at Matrix Group International. Listen in as top association executives tell all, revealing the creative and innovative ways they're increasing membership, generating revenue, nurturing engagement, and reimagining their organizations. By the way, if you've launched a new initiative, created new member services, or updated your governance structure and are seeing great results, I want to hear your story, and so do my listeners. I'd love to have you as a guest. Go to podcast.matrixgroup.net and apply to be on Associations Thrive. Now let's dive into this week's show. Today, I'm speaking with Johnnie White, CEO of the American Association of Clinical Endocrinology, or AACE. Johnnie, welcome to the show. Welcome back, actually.
Thank you. It's good to see you again. It's been a while since I've done the podcast.
I know. I'm glad to have you back and with a different organization. So, Johnnie, tell us about AACE.
Absolutely. So AACE is a unique organization in the sense that we focus on endocrinology. So as you stated the name, American Association of Clinical Endocrinology, and our members are endocrinologists and other healthcare providers that provide care to patients that deal with endocrine disorders, such as diabetes, osteoporosis, thyroid disease, anything that's endocrine related. These are the individuals that are seeing these patients and providing care to these patients.
So, Johnnie, who are your members? Are they doctors only? Who are they?
They are doctors, predominantly doctors. As you look at our makeup, probably about 80% are physicians. These are our endocrinologists, but the other 20 or 10% are what we call our endocrine care team members. These are the nurse practitioners, physician assistants, pharmacists, other primary care physicians. One of the things as you look at the data, and I use diabetes as an example, there's about 50 million people that are suffering from diabetes, type 1, type 2. And if you look at the amount of endocrinologists, practicing endocrinologists is close to about 4,000. So you do the numbers, there's not enough endocrinologists that's going to be able to see all these patients. So we're an organization that want to educate all the different types of healthcare providers that are part of this endocrine care team to see the patient. So that's why you have the physician assistants, the nurse practitioners, and so forth, also part of our organization. Our membership is about 6,000 people worldwide. We have a lot here in the US, but I think about 8 to 10% of our membership is outside the US. So we're talking the Middle East to India to the Asia Pacific area.
Johnnie, this is alarming to me. 50 million people have diabetes, but only 4,000 endocrinologists in the US. So does that mean that the average person with diabetes is not under the care of an endocrinologist? They might be seeing a GP, for example?
Absolutely. I think there's a number of the primary care physicians are seeing a number of these patients. When it comes down to complex cases, they're referring it to the endocrinologist because they're trained to be able to help these types of patients. And not to say that they're not seeing all types of patients with diabetes, but because of the education and the material out there for the primary care audience, they are able to see these patients and provide the care they need. But there is those complex cases that the endocrinologists are definitely going to see.
Johnnie, if I'm a nurse practitioner, why do I join AACE? Because if you're a nurse practitioner, you're often dealing with so many patients with different types of diseases. So you could be a member of any organization. So why would they join AACE in particular?
The reason why a nurse practitioner or a physician assistant, or as I call the endocrine care team member, wants to be a member of ACE is because of the access to the education, the
Mm,
guidelines that we present, the publications that we produce. The material is specifically about caring for patients with endocrine disorders. So if you want to be at the top of your game, you want to be a member of this organization because you're going to have access to this type of material and have access to networking with the experts that's in the field.
I see. All right. Well, I got a lot of questions about ACE, but I want to turn to your journey first. So, you and I worked together when you were CEO at the American Society of Appraisers. But talk to us about your journey and how you get to be CEO of ACE.
My journey started many, many years ago at a healthcare organization. Actually, my career started at the Endocrine Society. So it's
Full circle.
like a 360 in a sense of where I was and to where I am today. So I started the Endocrine Society many, many years ago at the bottom, as a coordinator in their meetings department, and then moved my way up to director of their meetings and CME services and global affairs, and then got recruited to be executive director for the Cardiovascular Research Foundation, and was there for about 10 years. And then was living in the New York area, wanted to move back down to the DC area. And then I took a job for senior staff of the AAO, the Otolaryngology Association, running their programs, global affairs, business development. But then I felt that I needed to take a break from healthcare since I was in it for as long as I was. So that's when I took the opportunity, took a risk because, I didn't know anything about appraisers. They took a risk on me, and it turned out to be a great risk because I learned a lot running that organization. I ran it for about 5 years, did great things for that organization, from helping the financials and helping grow membership and really upgrading their technology and that sort of thing. Deep down, I started to miss the healthcare field. That feeling of what you do really makes a difference for someone. I know the things that we're doing in this organization where we're educating the physicians and the endocrine care team ultimately is helping a patient down the line. And I think that really, for me, is mission driven. And I like that mission driven. So that's what drove me back to the healthcare space. And timing just worked out where ACE was looking for their new leader, and I was looking to come back to the healthcare field. And this is a field that I know very well. So, as they say, the stars aligned, and here I am today.
Johnny, how do you, when you're someone with a healthcare background, decide to dive into a new industry so that you can learn it well enough and deeply enough that you can actually run the professional society? So when you go from healthcare to the appraisers and then back out again, what's the process?
What's helped me throughout my career, and as I look back at my passion and education, I have a degree in computer science. So, one of the things as a person that's in computer science is all about data, understanding data and using that data when you're programming. And so you take that same philosophy in a leadership position, is understanding data to be able to make the right decisions. And so as I transitioned from healthcare to the appraiser organization, the first thing I did was just got a good understanding of the landscape, looking at the data. Where this organization sits now? Where does it need to be? And then looking at all of the trends and things that are associated with that to help move that organization along. And then as I transitioned back into healthcare, it's the same process.
Mm.
Looking at the data, where are the needs? And then understanding what their needs are, you facilitate the process to navigate the organization in the right pathway to meet those needs.
Johnny, what are you reading and what are you attending or learning, or who are you talking to find out these trends? So when you got the job here at ACE, what are you reading to dive into all this?
Let me first talk about reading. One of the things I try to do, and the same thing happened at ASA and in most organizations I come to, I really try to spend some significant time with the stakeholders. So, for example, with this organization's only been around for 30 years. So they're young as you think about associations. There's a lot of organizations that I've been with celebrating 100th year or so for 80 years and that sort of thing. So one of the advantages of that is the leaders, the past leaders, the past presidents are still alive. So I took the time to call each of the past presidents within the first few months of being at this organization. That helped me understand why they started this organization, because I was able to talk to some of the founding members of this organization who were president. So it helped me understand where this organization started. And then as I talked to the presidents that are more recent, what direction they were looking to take this organization. So that helped me to understand the past and where we're going from a future standpoint. Again, that process is something that I've done at most organizations. But again, these other organizations, been around for many years, so I didn't get the chance to talk to presidents, but I was able to talk to board members, past board members, staff, industry. I had the opportunity to talk to the stakeholders that are part of industry to, again, understand the relationship that the organization has, what's the good, the bad, the ugly, and try to figure out how to change the ugly and the bad to make sure everything is good. So it takes a good 6 to 9 months of this process of talking to all these different stakeholders and so forth to allow you to take that data to help you and move the organization in the right direction. And then in addition to that, looking at and talking to, I don't never call other organizations competitors. There's always an opportunity to align with other organizations that are in space. So that's the other thing I did, was reached out to all the other organizations that are in the endocrine space just to see where there's some alignments, where there's opportunities to work together. And then there's understanding where there are areas where that's their sweet spot and that's what they want to focus on, and where our sweet spots are in those areas that we never touch, because that's kind of what makes us that competitive part of our relationship. But understanding where those are helps you move the organization along too.
And were they friendly when you called them?
Yes.
Okay, good.
One of the things I loved about the endocrine space, and let's just talk about associations, most CEOs, no one's out there to kill the other guy.
Yes, 100%. It's lovely.
Yes, we're pretty cordial, and we always are looking for ways to work together. I mean, I think as association professionals, we know that in order to move things along, it's better to have more people involved than less, especially when you think about advocacy.
Yes.
We're trying to advocate on behalf of something. Having multiple people or multiple organizations on board helps move that needle rather than just one organization trying to move the needle.
Ah, yes. Johnnie, what I'm hearing is that there's a very intentional process that you use to really go deep with any organization that you're running. And my listeners cannot see the sign behind you, and I will read what it says. It says Mamba mentality. And the mantra is a constant quest to be the best version of oneself. And when we started this interview, I said, Johnnie, is that really behind you or is that virtual? And you said, oh no, that's really behind me. So talk to us about Mamba mentality.
Yeah. So if you don't know, Mamba mentality comes from Kobe Bryant, a phenomenal basketball player that played for the LA Lakers. Now, I will be honest, I'm not an LA Laker fan and never was, but I liked him as an individual. I liked his mantra of a fearless basketball player. If you ever seen him play, he was phenomenal.
Yes.
One of the reasons I think he was so phenomenal is because of that mantra. He always wanted to be the best version of himself. So he took the time to practice. When everybody's out the gym, he was at the gym still practicing. He was always trying to find ways to make himself better. So taking that same mantra, I think about that with myself. How can I figure out ways to be better in the things that I do? And as I think about that, I'm very open to constructive criticism. I'm not the type of person that I don't want feedback. I want feedback that helps me grow. I'm always looking to be a cheerleader for the other members of my team. I don't necessarily always have to be the leader. If there's an expert in the room that's a little bit smarter than me, I'm going to allow them to do what they are going to do. And I learn from that, so that that time comes when I need to step up and speak on whatever that topic is. Think back at the appraiser organization. I knew nothing about appraisers. But I would say after the 5 years being at that organization, I became the spokesman for that organization. I was being called to do presentations around the world on appraisers. And I'm not an appraiser, but I think going through that process of learning and trying to make sure that I'm trying to be the best person for that organization allowed me to be in that role.
Johnnie, I love this. And I love that almost every word in this mantra is significant because it's a constant quest, a journey to be the best version of oneself. I mean, like every word is so powerful in this mantra. I love it. I am totally stealing this.
You said it's a continuous process. It doesn't stop. Just because let's say you think you're an expert at something, it's always something you could learn to make yourself even better.
Yeah, 100%. Hey, I want to turn to something a little bit different in your personal journey. You are on the board of the AACE Board of Directors.
Yes.
I'm just impressed with that. I'm in awe of that. I don't know what it means. What does it mean to be on the board of AACE and what do you do?
It is a great opportunity to be on the board of the AACE. So if you don't know about AACE, it's American Society of Association Executives. It is an organization that represents organizations like myself. We have 50,000 members, which shows you that it has a huge voice.
I think I'm a 30-year member, Johnnie.
I'm pretty much close to that. So it's an organization that I see that's a leader in this space. It advocates on behalf of associations. We have a fly-in in March where we're going on the Hill and talking about different things that are associated with associations. Over the last few years, we've been working on some really great initiatives to help support the associations. So knowing that and seeing that, it was an honor to be able to apply and be a member of ASAE. And it's now allowed me to be able to support a industry that I've been working in the many years that I've worked in. And being on this board, it's a strategic board. We're thinking strategies. Michelle Mason is the CEO, phenomenal woman. And the board has her support in moving the organization even further than it was years ago under her leadership. So it's been a great experience so far being on this board.
Johnnie, what are some trends that you're tracking as a board member or as a board?
Well, go back to advocacy. There was a couple of things that was happening, as you may or may not know, with the new administration. They were looking at taxing associations.
Oh, yes.
We're all exempt from federal taxes. And as the current administration is looking to balance the budget, one of the areas they were looking at is, they could probably gain some more revenue if associations like myself would pay taxes. But the reason why we don't pay taxes is for multiple reasons, but we're an organization that have missions, and the money that we make goes back into the organization, goes back into the communities and members that we are working on behalf. So, if you start taxing these organizations, unfortunately, a lot of them have to go out of business because, the taxes that they have to pay will be enormous. So you don't want to be in that situation.
It'll be enough to really take them down. I mean,
yes,
the tax code literally says you have to be an organization created for the public good. Like that's in the charter.
Exactly. The last year and a half with this current administration was something that we were working on, and we were able to successfully convince the administration that that's not the path you want to take. So that's great. Another trend is trying to elevate the awareness of associations. I think we all say this at some point. Our mom, dad, family members never know what we do. They just know we travel.
Right.
And that's about it. So trying to create more awareness of this profession, this industry is something that we constantly work on. Going back to advocacy, one of the things that we're also successful in doing is the 529. So as you, a parent of a child, you could put money away for your child for college. You can use that towards tuition. But we know that there's a number of people that are not going to college. And so what happens to those funds? They just sit there. So again, creating awareness about associations. Associations provide training, they provide certifications. So why not allow this funds to be used towards these certifications and education. And again, I think we did a great job, and I say we, the ASA, did a great job in convincing legislation to make some alterations to the 529, where it allows now these funds to go towards other type of programs such as certification and so forth. And that's a win for the association world, because again, that's one of the things that we do for the community is provide opportunities to train and provide education.
Oh, 100%. So my son is graduating with a degree in mechanical engineering. And he said, Mom, I want to go for the certificate. It's going to be a couple $1,000s. And I said, we can use the 529 money.
Yes.
And Johnny, I helped lobby on that one. I was at a fly-in a couple of years ago, and that was one of the topics.
Good. Well, thank you for your support.
Hey, let's turn to AACE.
Yes.
You know, when I was talking to you during the prep, I made a mistake and called you the American Society of Clinical Endocrinologists. And you said, Joanna, we're now endocrinology. And that was a change that you all made. So why did you make that change? And what was the thinking behind it?
Yeah, so this change was made before I came on board, but I think it was a pathway that they should have taken, and they did, which is great. So again, previously it was the endocrinologist. And I think at that time, that's what was needed, because there needed to be an organization that was specifically for the clinical endocrinologist.
Meaning the doctors.
The doctors, yes. The endocrinologists, the physicians. But as time moved on, and as I stated earlier in the podcast, using example of diabetes, 50 million individuals that have diabetes, that's just one endocrine disorder. You have thyroid disease, you have osteoporosis, and then other rare disease, acromegaly, and so forth. There's a laundry list of endocrine disorders that are out there. And so you think about the amount of patients that have any of these type of endocrine disorders, it's about millions of people. And so as you look at an organization who's trying to educate healthcare providers to provide care for these type of patients, you have to broaden your scope, but you're not losing sight of your leaders who are endocrinologists. And so the process was that it made sense to broaden the scope and become the American Association of Clinical Endocrinology, so that we can bring in these other healthcare providers, such as nurse practitioners, into the organization so that they can have access to top-notch education, guidelines that are associated with these different disorders, publications, certificate programs, and all these different things that we offer now for what we call the endocrine care team. And so if you look at the hierarchy in terms of model, you have the endocrinologists that are leading, and those are the ones that are doing the education and writing all of our guidelines and so forth. And then you have this endocrine care team that is made up of all these other healthcare providers that are having access to these type of products to help them in providing better care to the patients.
Johnny, was it a battle to include other members of the clinical care team in the membership?
Whenever you have change,
yeah,
there is going to be some that are not going to like the change. So I think in any organization, there's the growing pains of that. And this organization went through those growing pains too. I think we're probably in a better position than we are when we made that change. But again, when you make changes, you're going to have some of that disruption for your membership.
Wow. Well, a bigger tent benefits the patients.
Absolutely.
Because now more people are getting trained. And speaking of patients, when you go to AACE.com, which is your domain, you first land on the patient portal. And then when you click on for the healthcare community, you go to the member portal. So I think it's significant that you go first to the patient portal. So talk to us about the strategy behind the patient portal.
Right. So one other thing that happened 5 years ago is they looked at the different strategies out there, and what they saw there was a need for is providing more education to the patient. So, you think about a lot of physicians have to deal with patients coming in and bringing material or hey, I saw this.
I read this on WebMD, right?
Yes, yes. So there's a lot of misinformation out there. So the organization found that there was a need to provide better material for the patient. And so what we have on our website is what we call patient journeys. There's one for diabetes, one for thyroid, one for obesity, and a few others. And it provides them information, material on the journey of dealing with a endocrine disorder, what the symptoms are, what are the different therapies and things that could help you deal with that endocrine disorder. And it's been one of the most popular parts of our website because there's so many people that are looking at it. Not only patients are looking at it, but the healthcare providers are looking at it because they're using that to refer their patients to so that they can get more information, or even not even just the patients, but the caregivers, the parents or whoever is taking care of that patient that has the endocrine disorder. So they're looking at this. So it's a very popular part of our website. And the way that our patient journeys are developed is we have a really great model. We're using the experts, our endocrinologists, but we're also using our endocrine care team members, and we also have patients that are involved so they can give their perspective on what's being read. Because you don't want to develop material that's maybe at a high level. You want to develop it at a level that the patients will be able to understand and absorb pretty easily. So that's why we have, for some of these, having actual patients on there and helping us review the material.
Johnny, I spent quite a bit of time on the patient portal, and it is really well done. Fantastic content and friendly to the AI engines, I was happy to see, with all the natural language queries.
Oh, good. Thank you. The team is doing a great job there.
Johnny, it's clear that ACE really has a commitment to education. I mean, I see the education that you offer. You've got an ACE certificate, you've got microlearning, you've got podcasts. So talk to us about the different strategies that you're using to really deepen this education. I'm specifically interested in the microlearning and the podcasts because they're maybe non-traditional, right?
Right. Another area that's very popular on our website are our podcasts. I mean, podcasts are easy to absorb. What I mean by that, they can be listened to at any time, from
Right.
driving your car or cooking and that sort of thing. And so we're finding a lot of people accessing our podcasts, which has been great. And so that's been something that we've been doing over the last number of years now. And it's been very, very successful. And it's one of those things that, not that it's easy to put together, but you think about comparing that to putting on a meeting or even a live video. I mean, there's all the logistics behind that. With a podcast, again, not saying it's easy, but it's one of those things that you can do in a more rapid pace.
Sure, absolutely.
If there's something that's a hot topic, we can get that going pretty quickly, faster than, having to put a meeting together. We're happy about our podcast. And in terms of microlearning, this is an area that we're just starting to get into. We just launched our first microlearning module just recently. This is something that we've been talking about over the last year. We have a educational roadmap, and one of the items that we talked about on the roadmap is microlearning. Because what we know, and we hear it, as a person is absorbing education, their attention span is 7 to 10 minutes. And then after that, they off to the next thing, especially in today's world, with all the different technology and all of us on Zooms and that sort of thing, our attention span is not as long as it used to be, or I don't think it's ever was long. I think we just start to realize that we need to do better in putting our programs together. So our microlearning modules, again, we just launched our first one. It's been a hit. People that have participated have given us great reviews. And this is our path forward as we move into this year and even future. This is an area that we're going to provide more of our microlearning, and we're making it a benefit. So if you're a member, you get a certain amount of microlearning modules as a member. So it's a benefit to be a member of the organization to have access to these microlearning modules.
Johnny, how long is a microlearning module, and do you still get continuing medical education?
Yes, you still get continuing education, and they are modules that add up to an hour or so forth. So they're about 15 minutes.
I see. So if there's a 60-minute module, it's broken up into 4 pieces, and you're tracking that they watched 4, and then they get the 1 credit.
Yeah, so the microlearning modules are in our learning management system. So the learning management is tracking all the stuff that you're doing for you.
Wow. Well, I'm going to be really interested in this, and we'll check in with you as your microlearning strategy develops. Johnnie, it was a pleasure to have you back on the podcast. I'm going to have you back. Thank you for joining me today.
Thank you. I enjoyed it and looking forward to our next time.
Thanks for listening to Associations Thrive. We're so glad to have you here. My personal mission and the mission of my company, Matrix Group International, is to help associations and nonprofits increase membership, generate revenue, and thrive in the digital space. I want to hear stories of how your organization is thriving in today's challenging landscape. Please apply to be on my show by going to podcast.matrixgroup.net. By the way, do you need help with a digital initiative? Maybe it's a website redesign, a new membership database, or a hybrid meeting that you're planning. I'd love to connect with you. Please visit the Matrix Group website at matrixgroup.net. Thanks again for listening to this week's episode of Associations Thrive. Don't forget to subscribe to the show, leave a 5-star rating, post a comment, and share it with your colleagues and friends.